Nonprofit hospitals across the nation are required to complete community health needs assessments every 3 years. These assessments are a systematic process involving the community to identify, analyze, and prioritize community health needs and assets. The findings are used to implement a corresponding strategy to address the prioritized needs. These assessments are becoming more sophisticated in their approach, are drivers of community collaborations, and often springboards to launch community health improvement initiatives. Hospitals and health systems have found that partnering with other organizations to conduct a CHNA has many benefits. It increases community buy-in and bolsters relationships with community partners. It facilitates organizations' ability to develop and implement more effective programs to improve the health of the community.
Our approach to thinking about the health of the population started a number of years ago. Our goal was to connect everything we do to what our board agreed was our purpose. We said, if we're going to really take the well-being of patients and their communities serious, we have to go outside our walls. The clinics, the hospitals, we all know that that is not enough to keep people healthy and as well as they possibly can be. So our initial approaches were into areas where we could really make a difference. We worked with schools, we worked with our neighborhood. We said there are things that we can do as an organization to improve the environment around our own institution that will have a positive impact on the community. We can work with our local schools. We can clean up our environment. We can invest differently. We can hire differently. We can buy differently. When we build things, we can employ contractors differently. So for us, it was a big package that we steadily evolved over time that helped us move from just taking care of sick people that showed up on our door to taking care of the breadth of the population.
Use the CHNA to identify and engage with patients and community partners. The process for conducting a community health needs assessment typically includes several stages, beginning with the local community health agencies and public health providers. It is also essential to clearly define the geographic and demographic features of the community. Next, information is collected. This includes quantitative information about the health outcomes in the community, as well as the integration of community members' input. A crucial step is then to prioritize what issues or needs that the hospital or health system will target for intervention and communicate that information to internal and external audiences. Next, interventions are developed and implemented with community partners. Evaluation of the results of those efforts will help to inform the next cycle of assessment.
Community health needs assessments have been a reality and a fact for quite some time. Certainly they were codified and required now through the ACA. And there are a few approaches to them, just like anything we do. We can do it and check the box and say, we've got a community health needs assessment, isn't this binder beautiful, and put it on the shelf, and it's a fairly perfunctory effort that doesn't really guide any of our strategy. That would be one approach that hospitals and health systems can take. The other approach would be to really take it as an opportunity to say, if the ambulatory space within our communities is where the patients want to receive care. If we're going to embrace population health or social determinants of care, or try to do more than just care within the four walls of our hospitals, or if we're just trying to determine what does our workforce, what clinicians do we need to add to our workforce within the four walls of our hospitals, knowing what the community demand is key to help determine who are the partners in our communities that we might want to partner with. What workforce do we need for this community? Do we need yet another primary care physician, or do we really need a cardiovascular surgeon because we just simply don't have one? That's what the community health needs assessment can help establish. Workforce needs, program development, how you can add back to the communities that surround your hospital and or health system. And my hope is that it won't be perfunctory, that it won't just be a nice binder that checks the box, but rather it will be a key component of how you embrace the opportunity to include that into your strategy.
Use the CHNA as a tool to identify unmet health needs in the community and also as a guide when considering what staffing and programmatic resources are needed.
Part of the process that we engaged in at Rush was we worked with what's now called the Alliance for Health Equity, again, collaboration. And that is a group of over 26 health institutions across Cook County. And we decided that we would collectively work on our community health needs assessment together and determine through data and surveying what the overall community health needs were going to be, and then each health institution would figure out within those needs what are the initiatives that you're going to do, how are you going to implement programs to address those needs. So we've been able to prioritize by working on things together and coming up with a joint strategy, and then working within our health institutions to figure out the implementation strategy.
There are a variety of ways that hospitals are engaging in the community health needs assessment process. The process may be led by a single hospital as the convener of the process. In multi-hospital systems, it is common to have a consistent assessment process across multiple communities, with tailoring to local needs. In some communities, 2 or more local hospitals may come together to develop a joint community assessment. In other communities, the Community Health Needs Assessment is a collaborative effort with the local health department.
We have a chief of strategy who does our every 3-year report on community assessment. We've got other people doing community assessments, and we all work together to pool our data with the public health department, so we're all not doing the same thing and then skipping other areas. So try and get a good picture for the 400,000 people who live year-round and the other 200,000 people who live seasonally or visit Collier County.
Organizations have asked us collectively to analyze the needs so that the community health need analysis is not simply that which we do for a tax return, but now it's focused again on the specialized knowledge of these small organizations that have made significant headway in the vulnerable communities. So I would say to any organization that would like to commit itself to population health in vulnerable communities, if you don't create partnerships with existing, small, probably not-for-profit, mission-oriented organizations, if you don't create partnerships with local thought leaders, be they elected officials, clergy, educators, what have you, if you miss that step, the chance of being successful in population health or improving the lives of people in vulnerable communities is seriously compromised.
The CHNA process helps organizations strategically align their approaches. Trustees can become an active part of this by supporting the engagement of clinical leaders, enlisting their own organizations or community groups to support the assessment process and implementation plan, partnering with hospital leaders to drive success in outcomes in the community.
You know, I think that the way that organizations discuss with their boards the priorities around population health are still evolving. We all have the requirements of community health needs assessments and a requirement for your board to understand what those issues are and to ultimately adopt and approve a plan that your organization has for addressing your community health needs. But frankly, I see that as just sort of the first step in really creating a comprehensive community health approach. That gives your board a sense of the tactics around the assessment and a few strategies. But the specific requirements of CHNAs are sort of just like adhering to the law. It's a minimal standard. There's much more that's required, and so you then have to decide, okay, how do you really inculcate thinking from a population and community health perspective across your organization? How do you set metrics that are different than the traditional metrics? How do you help your board understand that that community health metrics that may be outside of your complete control are metrics that a board ought to hold a CEO and her or his management team accountable for? And those are the kind of conversations that many boards are having now. It's the kind of conversations that we have in my organization that helps us sort of get beyond the traditional sort of first wave economic factors around healthcare delivery.
To increase the effectiveness of the community health needs assessments, hospitals and health systems are actively engaging patients, families, and community members in the discovery and planning process.
We've looked at the 5 million people that live and work in our service area, and we've defined a variety of populations based on a number of different characteristics in order to best understand how we can make their lives better. And there are the obvious metrics and the obvious demographics, but for the most part, you have to be in and of the community to fully appreciate what a predisposition of definition is for a demographic. So we have 5 million people that we have looked at in multiple ways to understand their cultures, to understand their ethnicities, to understand their needs, and more importantly, to try to figure out how we can be a trusted, more or less custodian of the needs that they have in everyday life.
Board engagement in the Community Health Needs Assessment process can help to set the vision for the organization.
Well, the first thing that is really important to do with your board is to actually have a conversation about what is our purpose in this community, and what is the community. What is the geography associated with that? What's our responsibility in that community? How do we partner with others? But ultimately, it's setting that vision for the role of your organization. And what I find in those conversations is that's what really people want. They want to not just be buildings and be beds. They want to be effective participants in how do you create healthier communities. So that's actually the easier part of this. The harder part is getting to understand the implications of that, which includes not owning everything, partnering in different ways with people.
We have a very long-term view. We think in cathedral thinking. We're into the school system in a big way, public and private, and we're spending a lot of time and effort, even though we may not be around to see those changes. We'll get these kids off to a good start. If we spend, and these are real numbers, $300 or so to get a late elementary school or middle school child never to start smoking, we can save $800,000 on an 80-year-old woman who's smoked all her life and sadly has got stage 4 lung cancer. And to try and add 1 year of life to that woman's care, it cost $800,000. So you got $300 for the child, $800,000 and the misery later on. Anyone would see this investment. Now, will we see this? Will I live to see this investment in this 5th grader? Not necessarily, but it's still the right thing to do. We're looking for the future, and we want to change the direction of healthcare. We can't continue in the way we are, and what's holding us back, sadly, is the fact that we have this system that rewards us for sickness.
As you hear from and talk with your facilities leadership team about your community's health, you may want to consider the following questions. How is your board involved in the Community Health Needs Assessment process? How do the assessment's findings influence your overall population health strategy? What are the key priorities that your organization is addressing based on community assessment data? In what outreach activities or community partnerships are you currently engaged? What performance indicators correspond to these programs and why were they chosen?